Hello and welcome. Today we're going to talk about a really important health topic, addiction. Now, it's a word we all hear, but what does it actually mean? Well, in this explainer, we're going to break it all down in a really simple, clear, and supportive way.
So here's what we're going to cover. First, we'll get a basic definition. Then we'll explore the different types of addiction. After that, we'll learn how to recognize the signs. And finally, and this is the most important part, we'll look at the path to recovery.
All right, let's dive right into our first section. To really get a handle on this topic, we have to start with the basics. What are we actually talking about when we use the word addiction?
Okay, so at its core, addiction is this really powerful need or urge. But here's the key part of that definition. It's when the behavior keeps going, even when it's causing harm. That could be harm to your health, your job, or your relationships. That's the real clincher.
So, what does that actually look like in day-to-day life? Well, it usually involves really strong cravings. You know, that feeling that you just have to do it. There's also a real difficulty in controlling the behavior, and you might find that a huge amount of time and energy is spent on it, all while it's having a clear negative impact on your life.
Now, here's something that's really important to understand. Addiction isn't just about drugs or alcohol. So let's jump into our next section and look at the two main ways it's categorized.
And this lays it out perfectly. On one side, you have substance addiction. That's the one most of us think of first. It's about using a substance, like drugs or alcohol. But on the other side, we have non-substance or behavioral addictions. And that's where an activity itself becomes uncontrollable.
So for substance addiction, you're looking at things like alcohol and nicotine, which are legal, but also illegal drugs, and even the misuse of prescription medications like opioids or sleeping pills.
And here's the behavioral side, and this can be a real eye-opener for a lot of people. We're talking about everyday activities, like shopping, using our phones, even working, that can cross a line and become a real addiction when they become compulsive and you just can't stop.
Okay, so we know there are substance and behavioral addictions. But how can you actually tell when a habit has crossed that line? In this next part, we're going to look at the common signs to watch for and then dig into why this even happens in the first place.
These are some of the key things to be aware of. Is the habit being used as an escape from stress? Is it taking up a lot of headspace? Maybe you're noticing that important responsibilities at work or home are getting neglected. But honestly, a major red flag is wanting to stop or cut down, but finding you just can't.
Right, so that covers the what to look for. But it begs the much bigger question, which is why? What is actually going on that leads someone down this path?
It's really a cycle that happens inside the brain. See, it often starts with something that gives a feeling of pleasure or relief. And of course, the brain's reward system says, hey, that was good, let's do it again. But over time, with repetition, the brain's actual chemistry starts to change. This leads to two big things: tolerance, which means you need more and more to get the same effect, and withdrawal, which is when you feel physically or mentally awful when you try to stop.
But here's the thing. It's almost never just one cause. The risk of developing an addiction is super complex. It's this whole mix of things. You know, stressful life events or trauma can literally change how your brain responds to stress. Your genetics can play a part, making you more sensitive to that reward feeling. And of course, other health conditions like anxiety or depression can create this vicious cycle where one problem fuels the other.
Okay, so we've talked about what addiction is and what can cause it, but now we're moving on to the most important part of this whole conversation: hope. Because recovery is absolutely 100% possible.
Now, there's no one-size-fits-all solution, but treatment often works best as a team effort, using a combination of these three things. You've got medicines that can help with the physical side of things, like cravings and withdrawal. Then there's therapy, like cognitive behavioral therapy, which is all about learning new, healthier ways to cope with life's challenges. And finally, support groups, which are just so vital for connecting with people who truly get what you're going through. This is a question so many of us have asked. It is just so incredibly hard to watch someone you care about struggle. You feel helpless. So what can you actually do that will genuinely help?
The absolute key here is to approach them with care, not criticism. So first you watch for those signs we talked about. Then find a calm, private moment to talk, and this is crucial. Just listen. Listen without judgment. Your goal isn't to fix them, it's to gently and lovingly encourage them to talk to a doctor or a therapist. And if you take one thing away from our chat today, let it be this. Understanding what addiction really is, that it is a health condition, not a moral failing, that is the most powerful first step. It opens the door to realizing that help is out there and that people can and do recover every single day.
If anything we've talked about today has hit home, either for you or for someone you care about, please don't wait. A fantastic first step is always just talking to your doctor. And here are some amazing Australian services like the Alcohol and Drug Foundation and Lifeline that are there to help right now. Remember, reaching out is a sign of incredible strength.